My name is Sarah. I'm one of the respiratory therapists with Mainland Sleep Diagnostics. I've been a respiratory therapist for approximately 11 years. I've worked at a couple of the larger centers around the lower mainland, and I still work casual for one of the hospitals, and I've been doing this for about 4 years. Today I'll be talking about getting set up on a CPAP machine. So once we've received a referral from your physician, we'll be getting you set up on one of these devices. There are a few different CPAP machines that we can use. We usually use machines from one of the larger companies that have great warranties, but between whichever one, we can always discuss which one works best for you. These are two of the machines. This one is called a ResMed machine, and this one's a Philips Respironics. Just to get it set up, when you come in to come see us for a setup, it's usually about a 35-minute to an hour appointment with one of the respiratory therapists. We'll go over your sleep test with you that you did in our office, and we'll discuss options for you, as well as we'll go through educating you a little bit about obstructive sleep apnea, and we'll talk about how to use your machine, and we'll actually get you started in our office so that you're comfortable to use them once you get home. Just to go over the CPAP machines now, this is one of them. The CPAP machine always needs to be plugged into the wall, and in the back here is a hose. This hose is what's connected to the CPAP mask, and it fits right into the back here. And on this side, the filter is right in here. You pull this tab down and it sits right in here. You clean it with soap and water, dry between paper towel. Once it's dry, pop it back in. On the side here, there's a humidifier pot. It's important to use humidity so that you do not get any nasal dryness, throat dryness, or any sort of congestion. To open the humidifier pot, you just pull out the humidifier pot like so. The water you need to use in here is distilled water, which you can pick up from any pharmacy, any grocery store. To open this container, you lift up the lid like so. Put the distilled water in through this, into this big hole, and there's a maximum line, minimum line. It's important to keep it right below the maximum line. To close it closes up like so and just slides right into the machine, just like so. And in this machine, you want to plug in the power cord into the side right here. Again, plug it directly into the wall. This humidifier pot, to open it, you pull this tab forward and it pulls out like so. And you also add distilled water to this container. There's a maximum line. You want to keep it below the maximum as well. The hose on this machine just slides on to the top, just like so. One important thing to note in this machine is where the filter is. The filter is right where the air intake is. To get to this filter, you just lift this tab up and it slides right out, just like so. This filter needs to be cleaned once a month with soap and water, dried with some paper towel, and pop back in. We start off with an automatic CPAP pressure, so the machine will adjust according to what you need to keep your airways open. Once you've been set up on a machine, you will be coming in for a follow-up with your CPAP machines in 1 to 2 weeks. We will see what pressure you use 95% of the time to keep your airways open. We will titrate your machine to that pressure, and you will be repeating an oxygen test again at that pressure to verify that that is the pressure required to keep your airways open, and it provides a stable oxygen and a stable heart rate with that level. So once we've performed the oxygen test, we will be sending all the reports to your physician. It is important to follow up with them, and we will also be following up with you on a regular basis. Once you've purchased your machine, you'll be coming in for a regular follow-up approximately every 6 months to have your machine checked out and to make sure everything is functioning well on your machine.